low dose versus standard dose intravenous alteplase in acute ischemic stroke. Definitions: thrombolytic therapy for acute ischemic stroke with a lower than standard dose of intravenous alteplase may improve recovery along with a reduced risk of intracerebral hemorrhages.
Again, let's go. Ready? Okay. All right, so I got my camera and I've got it rolling. So basically, you came in about 11:30 tonight. You came in with having symptoms of a stroke, a right-sided stroke, right?
Yes.
And then they gave you some TPA. And what I wanted to do for this video that ends up on YouTube, I wanted to do a teaching video on
Applications in nursing. In both groups, the mean time for the onset of stroke to administration of alteplase was 170 minutes. The mean dose of alteplase administered as an infusion was 35.5 milligrams in the low dose group and 56.0 grams in the standard dose groups. Blood pressure control. In the part of the trial dealing with blood pressure control that included 35 patients with elevated systolic blood pressure and 20 and 232 in the standard dose group were assigned to rapid blood pressure reductions.
A stroke is an acute condition, meaning it has a rapid onset, caused by the interference in blood flow in the brain that results in a lack of oxygen and the death of brain cells. An ischemic stroke, which accounts for approximately 87% of all strokes according to the American Heart Association, occurs when blood flow to the brain is blocked.
Pros and cons. The primary objective was to determine whether the low dose would be non-inferior to the standard dose with respect to the primary outcome of death or disability at 90 days. We was defined by scores of 2 to 6 on the modified ranking scale. Secondary objectives were to determine whether the low dose would be superior to the standard dose with respect to centrally adjudicated symptomatic intracerebral hemorrhages, and whether the low dose would be non-inferior in the ordinal analysis of modified ranking scale scores.
Hello again, this is Frank Gaillard from RadioPedia.org, and today we're going to be discussing imaging of acute ischemic stroke. In most instances, cerebral ischemia results from a thromboembolism, either from the heart or from the carotids. Rarely it is also due from paradoxical emboli through the patent foramen ovale or from aortic atherosclerotic disease. This is seen most commonly in the setting of either angiography or cardiac surgery. In situ thrombosis within the cerebral circulation is seen either superimposed on pre-existing arteriosclerotic disease or in the setting of arterial dissection. Imaging of acute stroke is performed either with CT or MRI. The majority of imaging of acute strokes is performed with CT, although MRI is in fact more sensitive. The reason for this is mainly to do with availability of MRI and the ability to get a patient in and out of the CT scanner rapidly without the concern for MRI-compatible resuscitation equipment. The mainstay of imaging of
is opting in Ecuador. This surgery it can be applied much in our country because there are a lot of people have stroke.
Of acute ischemic stroke with clot retrieval device. Ischemic stroke is a condition in which normal blood flow to the brain becomes interrupted. When a clot becomes lodged in one of the arteries that supplies blood to part of the brain, the tissue is deprived of oxygen. Clot removal devices are designed to treat ischemic stroke by removing the blood clot from the artery. The clot removal procedure begins by advancing a guide wire through the blood clot within the artery. A microcatheter is advanced along the guide wire until it is beyond the clot. The guide wire is retracted and the clot retrieval device is advanced through the microcatheter and deployed as the microcatheter is retracted. Once unsheathed, the device expands, pushing the clot to the walls of the artery and immediately restoring partial blood flow. Over the next 2 to 5 minutes, the device becomes embedded in the clot. The clot retrieval device, along with the blood clot and microcatheter, are removed from the body. Blood flow is restored and verified with imaging.
Conclusions. This trial involving predominantly Asian patients with acute ischemic stroke did not show the non-inferiority of low-dose alteplase to standard-dose alteplase with respect to death and disability at 90 days. They were significantly favored systematic intracerebral hemorrhages with low-dose alteplase.